Hello everyone. Today we are going to be discussing a question from typicalpt's platform. Let's jump right in. Alright, here's the question. A 58-year-old male presents with significant post-operative shoulder pain and limited range of motion following surgery for a full-thickness 2.5 centimeters rotator cuff tear. In terms of the mechanism of injury, this occurred during a skiing accident, which resulted in a traumatic tear of the supraspinatus tendon. The patient underwent a mini-open, arthroscopically assisted rotator cuff repair with subacromial decompression. Preoperative imaging confirmed a full-thickness supraspinatus tear with retraction, associated subacromial bursitis, and mild acromioclavicular joint osteoarthritis. The past medical history includes hypertension and hyperlipidemia, with no prior surgical history. Current medications include lisinopril, atorvastatin, and acetaminophen as needed for postoperative pain. On examination, the surgical incision is healing well, with mild swelling and tenderness at the anterolateral shoulder. Passive range of motion is limited but remains within the surgical protocol, and special tests and manual muscle testing were not performed due to the recent surgery. As the patient transitions from the minimum protection phase to the moderate protection phase, the physical therapist plans to initiate isometric exercises to stabilize the glenohumeral joint. The question asks, which of the following isometric exercises should be performed first? Let's go through the answer choices. A. Isometric exercises should not be performed in this stage of recovery. B. Submaximal multiple angle isometrics. C. Alternating isometrics in non-weight-bearing positions. D. Rhythmic stabilization isometrics with light upper extremity weight-bearing activities. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice C, alternating isometrics in non-weight-bearing positions. Now let's explain why choice C is correct. During the moderate protection phase following rotator cuff repair, the primary goals are to develop neuromuscular control, strength, and endurance of the shoulder while continuing to protect the healing tendon. Isometric exercises are appropriate at this stage, but they must follow a specific progression. The safest and most appropriate starting point is alternating isometrics performed in non-weight-bearing positions, as this minimizes stress on the repair while activating the stabilizing musculature of the glenohumeral joint. The recommended sequence begins with alternating isometrics in non-weight-bearing positions, then progresses to rhythmic stabilization isometrics with light upper extremity weight-bearing, and finally advances to submaximal multiple angle isometrics. Since the question asks which exercise should be performed first, choice C is the correct answer. Now let's review why the other options are incorrect. Choice A is incorrect because isometric exercises are appropriate during the moderate protection phase and are commonly used to improve shoulder stability when introduced correctly. Choice B is incorrect because submaximal multiple angle isometrics are introduced later in the progression and should not be the starting point due to increased demand on the repaired tissue. Choice D is incorrect because rhythmic stabilization with light upper extremity weight-bearing is a progression from non-weight-bearing isometrics and should not be performed first. Now that you've completed this case, take a moment to record the key points in your typical PT digital notebook. Use it to organize what you've learned and reinforce how to apply core integumentary concepts when evaluating and managing musculoskeletal-related conditions. Thanks for watching today's question of the day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at typicalpt for daily study tips, quick reviews, and motivation to keep you going.